This program is brought to you by KbroVet. Learn more at KbroVet.com.
Hello, I'm Dr. Gaemia Tracy, board-certified veterinary neurologist. Thanks for having me today. Now ask me anything. Why did I become a neurologist? I love the aspect of medicine and surgery being combined into one, being able to help patients both with my hands and with medical knowledge. And also neurology is like an elaborate puzzle that you try to solve. In patients that can't talk to you, you have to figure out where the problem is. And you also have to figure out how to best help those patients. So the combination of that made it just a specialty that I love. The strangest neuro case that I've ever seen? A good question. I think it's a cat with myasthenia gravis. So myasthenia gravis is not a very common neurologic disease, and it's also less common in cats, so it's more commonly seen in dogs. So to see a cat presenting with myasthenia gravis, which is a disease that affects the neuromuscular junction, making pets weak, was weird. But I had a high index of suspicion in this cat, and then the testing for it is called a tensilon test, where you give an injection of tensilon and it allows the patient to get up and walk. And when I gave an injection of tensilon to this cat, he was able to get up and walk, which suggested that he had myasthenia gravis. And I treated him for it, and he ended up doing great. So all of those things made that a really strange case. My most used neurological tool is probably an MRI. My favorite tool, I have to say, from day to day is a hemostat. The reason I like the hemostats is because it's multifunctional. It can be used to check reflexes as a hammer. It can also be used to check sensation, through touching the eyes, making sure they can blink. And it can also be used to see if dogs can feel, pinching their toes, checking for reflexes along the back. So although it looks simple, the hemostat is a very useful tool for neurology. What's easier, epilepsy in cats or dogs? I'd say epilepsy in dogs ultimately is easier. They generally respond to medications better. It's easier to reach a diagnosis for dogs. Cats with epilepsy have a various number of causes of why they have epilepsy. And they can be very different from cat to cat. And then their medication tolerances are also different than dogs. So I think ultimately, treatment of epilepsy in dogs is easier. KbroVet-CA-A can be used for canine epilepsy in dogs with idiopathic epilepsy when compliance is key. So it's given once a day after therapeutic levels are reached in the blood, and it can be easily monitored with blood level testing. KbroVet-CA-A works by passing through neuronal chloride channels, hyperpolarizing neuronal membranes. This raises the seizure threshold and stabilizes neurons against excitatory input from epileptic foci. I like to tell parents of newly diagnosed epileptic patients that they can play a pivotal role in helping their pets, as well as strengthening that human-animal bond, because their pets are relying on them for treatment. So they can learn what their tendencies are, how to monitor them, as well as giving them treatment to help extend their quality of life. All right, so those are all the questions for today. I had a great time. Thanks for talking to me about neurology.